There's a lot of acronyms thrown around today. One of my favourite meetings I was at a few years ago was where that's about halfway through, so if we go back to the start. One of the favourite meetings I was at a few years ago, we asked an audience of rather senior people in the UK who could name all the acronyms of the various organisations like not just BRCs but AHSNs, etc, 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 etc. And in the whole audience of 50 senior academics in the UK, one person could actually identify all the acronyms of what was going on, and that was the person who'd invented the names of most of those acronyms, I think. So I find it a very confusing business. How do I advance slides on this thing? Perhaps that. So I'm fortunate to be director of our Biomedical Research Centre, and I thought probably we should just say something about NIHR and their mission. And the important thing is they are trying to improve both health and wealth, and we understand that very clearly, and there's a big focus from government now on trying to improve the status of UK PLC. And biomedical research centres, there's 20 of these around the country. So we are very fortunate. We started off with a small single disease theme, musculoskeletal disease theme, and now have expanded to a 20 million plus 6 disease theme, BRC. And we collaborate, as Seamus indicated earlier, very strongly with our northern colleagues in Newcastle, Sheffield and Manchester, and that's been a great collaboration. But these are all centres chosen for world-leading expertise in research in their areas. So I want to give you a flavour of a bit of the research that's going on within our BRC, and just to put that infrastructure in context, BRCs are early translational work. So we take stuff from preclinical into clinical, early phase trials. That's the area we're working in. And if you want to do other sorts of translational work, you might move later. And I've highlighted the HealthTech research centres too. So you can sort of see all the time NIHR is thinking about translation and adoption. And remember, the average time for most clinical things to move from somebody's idea to change in clinical practice is unfortunately about 17 years. So trying to adopt that and move it through quicker is one of our key aims. And it's been mentioned already that our key partners, our most important partners here for our BRC were the University of Leeds and LTHT. And as Seamus mentioned, Phil Wood's been fab, and Julian before him as CEO, in trying to keep us a tight organised group. With our new BRC, we were tasked with looking for other people to work with, and we brought in groups from York University, and I think that's just the start of us looking around the region. Manchester's also been very good at networking around its region, and we need to be doing the same in our region to bring in the best people, the best expertise that we can play off. So the important things about BRCs, they're patient-focused, they're patient-led. We're trying to increase that speed of translation. We are collaborative and multidisciplinary. We have not only EDI in our water, but we really try to make sure everything we do is looked at with a filter that is inclusive. And we have a strong, I won't be talking today about our strong academic capacity development group, because really we know there is a real problem in England about bringing through a researched workforce, and that's dropping off, especially our academic research workforce. So we've really got to be watching our people development, our individual development. Now, so this is our theme. David Jane is, of course, central to this diagram. This was done deliberately to keep him there. Now, so we've got 6 disease area themes. I don't have time today to talk about our patient and public involvement, engagement and participation, But that group is very powerful and very strong, and we've now moved to the stage where we've embedded somebody in HealthWatch Leeds. We are embedding people in third sector organisations because we realise we are not getting through to many patients, to underserved communities, without being part of them and working with them. So I won't underestimate the importance, but that's critical to anybody trying to do anything in the healthcare sector, is to have patients involved from the start. There's our 6 themes: surgical technologies, heme, pathology, antimicrobial resistance, musculoskeletal and cardiometabolic. And across these 6 themes, there's roughly 19 work streams. And I'm not going to go through every single one for you because it really will put you to sleep. But antimicrobial resistance is a small problem for the country. Very soon, there will be more deaths due to this than cancer. So this is a major problem facing the whole world, and this group led by Mark Wilcox is really doing great stuff. And I'll just say they work a lot with industry, especially with development of new drugs, and they've got various in vitro models for looking at what's going to be the things that possibly cause Clos difficile, looking at ability of drugs to work. So this is strongly involved with industry, and each time I'd like to point out that each of our work streams works very well with industry. Cardiometabolic disease, we've got much worse cardiovascular outcomes in the north than in the south of the country, and there's about 1 million people with heart failure. Our particular theme is a cardiometabolic theme, so it's not just about heart disease, it's about heart disease related to diabetes. And this is a huge wodge of people. You'll be aware that the thing that will bankrupt the NHS or threatens to bankrupt it is multi-morbidity. It's multiple long-term conditions. And that's what our BRC is focusing on, is long-term conditions, and each group is looking in that area. So a lot of work going on and a lot of work with industry. David Beach, who runs this, has a spin-off company, HealthTech, looking at calcium channel movement across cardiac membranes. And they are launching a whole lot of exciting things, also anticoagulant therapies, launching their own company. So a lot of work and a lot of development going on in this. Haematology is big. This is what we're doing with York, and we've got a regional network of haematology with massive numbers of samples that we're just starting to look at and employ the power. And I should say that one of the major strengths of Leeds and its surrounding network has been patient cohorts. And we can't underestimate that. There are places in the country with super excellent science and no patients. And we have the substrate here for us to do an awful lot of work in Yorkshire based on that. So haematology, working in various diseases, especially haematological diseases associated with ageing. We've got a pathology theme, which is using fecal immunochemical testing or FIT testing to improve screening for bowel cancer. You'll be aware microbiome and certain pathogenic toxins from bacteria, from bowel bacteria, are important for cancer screening. And Phil Quirk leads this, doing really innovative world-leading stuff. And with his collaborators is also looking at bringing AI to histological diagnosis, but also to tissue and other diagnoses. So this is pretty exciting because bowel cancer remains a major problem and a major killer for the country. MSK disease, being our most mature theme, has got 7 different work streams, and I'm not going to go into all of them, but we cross inflammatory arthritis through to osteoarthritis. So the whole gamut of problems we've got world-leading expertise in, and this has been the jewel in our crown for some years. Already in the first year of this BRC, we've probably got over 4 million of external industry partnering for projects within this. So this is doing really well. And on to just surgical technologies. I think other people today will be discussing bits and pieces of these, but we've got 2 work streams within surgical technologies. And this is one of the first, I think it was mentioned earlier, BRCs to have a surgical work stream. And it's really important, I think, for surgery that it it's such a big part of the NHS that we have work streams and themes that are related to surgical outcomes. So just briefly to talk about that, I think some of this has been touched on already, but introducing immersive technologies in the start for rehabilitation. This is David Jane's work stream, so David will probably discuss some of these later on. Oh, did I miss something there? And also David's involved with bringing robotic and AI virtual surgery solutions, as well as nanotechnologies, and looking at identifying suspicious areas of tissue, identifying extent of tumours. So this is all very exciting to improve precision of operations and virtual operations. This is Hemant Pandit's surgical stream. He's already mentioned iSmart is implantable sensor work, but there's wearable sensors. There's a lot of work going on with Pete Giannoutis looking at fracture healing and improving fracture healing. 850,000 fractures a year in the UK, 10% don't do well, 10% don't heal properly. Massive market, and those people have big problems throughout their lives. So a lot of work going on to improve healing. And diabetic foot ulcers, 1 million people in the UK with diabetic foot ulcers, and they've done nice work showing that the impact of that is like having an amputation. So big group, and Dave Russell and his group looking at various ways, both with injectable fat scaffold, and this is sensor work to understand how people walk and where they're putting their weight, but you can reduce ulcers if you change basically the shape of the foot and change how you take pressure through the foot. So exciting stuff going on here. So how does the BRC work with industry? In a number of ways. We talk to people about designing their trials. We show them the problems within their clinical areas. We help design how things are going to happen as you walk through the NHS pathway. We've got a state-of-the-art imaging facility for 3T-MR. As I mentioned earlier, the patient and public involvement expertise is world-leading. We'll help with collaborative funding applications. Patients remain the key to Leeds' success, is harnessing our patient power in this region. And I think working together with our partners, with the HealthTech centres, this is how we're going to really put Leeds on the map. And I think I'll finish there. Hopefully got us on time, V.